Hi, I'm Dr. Jeffrey Marino from Bellissimo Plastic Surgery and Med Spa. Welcome to Bellissimo Live. In this episode, we're going to demonstrate the deep handpiece on our Virtue RF device. You've heard me talk about it. Now tonight we're going to demonstrate it. Angie is here, is going to be performing the actual treatment on Beth, who, as you know by now, is works with Ella, but she's in charge of our social media. And so who better to try it out on than a young lady who we really can see a lot of difference with her, and also somebody who can now experience it. And, you know, especially in our age group, you can see a big difference. So tonight we're going to start talking about the depth of it. We'll answer some questions and kind of go through this. So we've talked about the Virtue RF, which is a microneedling radiofrequency device. And so in the past, we've talked about the smart handpiece, and we've used that all over the face. It really is nice for treating fine lines, increasing the tone of the skin. It goes, basically penetrates to just into the deep dermis. Then the needles are small. They're tiny little 36 needles that just give you micro trauma in the collagen, and so that helps the dermis sort of repair itself, and that can help thicken. But what each needle does in the last 1 to 2 millimeters, it will also give off a radiofrequency pulse, which causes some heat, and that will heat the collagen and help some contraction as well. So that's what we've done in the past, but now we have 2 new hand pieces. And so we've talked about the deep hand piece, and this is where we're going to be treating, mostly at this stage, we're going to be treating the buccal fat pad that a lot of people want to treat. I'm not a lover of trying to take it out surgically. I think sometimes you can overcorrect and take out too much. And as we age, we tend to lose fat in our face. And so my worry is that as we age, when patients have had a lot of buccal fat, which is the fat right here that everybody worries about, because that kind of gives you that full face, and we want a little more contour. But if you over resect that, and as you get older, you'll start losing some of that volume, and so you'll have more of a sunken face as you get older. So I've not been a big proponent of taking it out surgically, but in this case, the nice thing about this is that we can control with each treatment how much we can dissolve, and Beth will actually guide us as to when to stop her treatments. So sometimes it's 1 treatment, sometimes it might be 2 or 3, and they're about a month apart. So we're going to treat this area on her, and the other area that's really good for the deep is the submental area. So that's been a hot spot for the last several years. I've been doing submental liposuction for about 20 years, but in the last 2 to 3 years, it's really caught fire, both men and women. So a lot of people in the past really want to take care of that double chin, this area right in here. But nowadays, both men and women, they want to contour that lower jawline. They want to contour, they want to get a sharper angle right in here, all the way out to the angle of the mandible, which is the lower jaw, underneath their chin, all the way out here, and all the way down to basically into the hyoid area right in here. So this whole area can be treated. Patients will ask us why, you know, how is that different than Kybella? Kybella dissolves fat and is only used right here. You can't use Kybella out in this area. So in this area, and especially for somebody like Beth, who's got good contour, she has a little bit of fullness in here, a little bit of blunting of the lower part of her jaw. In a non-surgical way, minimally invasive, we can help contour that with the deep handpiece. And so we're gonna show that tonight. So we're gonna actually start here, go all the way out, and then come all the way out into this area as well. So we're gonna kind of go through that demonstration. So at this time, Angie's going to get ready. I'm going to move out of her way.
Okay, back.
But
Ready? Okay.
so you're going to get to see hers now. She has been numbing with a topical numbing cream for about the last 30 minutes. And so that's what we usually do, 30 to 40 minutes of topical numbing. And then the procedure itself, it takes anywhere from about 30 to 45 minutes, depending upon if you're just doing the buccal fat pad or if you're just doing the submental area, it's going to be less than that. But combining them will actually be a little bit longer.
Feel my finger first. 3, 2, 1.
How did that feel?
Barely felt it.
Wonderful.
So the difference between the deep handpiece and the smart handpiece is still 36 needles. The same kind of procedure, the needles will come out, cause some micro trauma, and also emit that radiofrequency pulse, which causes some heat. With this handpiece, we can go a little bit deeper in depth. So when we're treating like the buccal fat pad, we can go a little bit deeper than the smart. Also, the deep handpiece will actually generate more heat than the smart smart radiofrequency handpiece can generate. So when we want to dissolve fat versus just skin tightening, then this is a better choice. So we'll treat it at a depth of about 3.5 millimeters, and then for the first pass, and then we'll kind of back out to 3.3 or 3.1 and treat that on a couple of passes.
And I can really barely feel a thing. It just feels like little tingly pricks, but no like pain really.
Any discomfort?
Dr. Antarino, did you talk about when you would use the Virtue Deep versus the Exact?
So the third handpiece that we've talked about just briefly in the past is the Exact handpiece, and we're going to demonstrate that in the near future. So the Exact handpiece is a single needle. Again, the needle can be controlled at the depth that it comes out, and it generates also the radiofrequency pulse. But in that area, or that handpiece, I treat the under eyes. So patients that have some fat pads in the lower eyelids, also a little bit of swelling, which we call malar bags or festoons, this handpiece can actually penetrate down into just below the skin, into that fat pad, and the same thing, dissolve that fat pad and tighten that skin. So as long as we're getting older and we're getting that crepey skin, what we're finding is that handpiece can really tighten up that skin for us. So we'll demonstrate that in one of the next upcoming Bellissimo lives. So the difference is the Exact handpiece is just for the lower eyelids. The deep is cheeks, submental area. There's other areas that we've been using the deep as well. We can actually do the fat pads in front of the armpits. We've been doing the arms. So patients that are having some crepey skin, maybe a little bit of thickness or fatty tissue in the arms, we're treating that. We're just starting to try it out on the areas on the lower part of the thigh. So especially women that are getting that crepey skin, we're really seeing if that's going to help tighten that skin, because from a surgical standpoint, that's a tough area. You can't liposuction that area, and as ladies are getting older and that skin gets a little bit thinner. So we're using the deep hand piece for that, so we'll keep you posted and kind of let you know how things are going, but we have some high hopes for that.
Dr. Antarino, are the results immediate, or how long does it take for the patient to see results?
So the results are not immediate, but you might feel a little bit of tensing of the skin over the next few days, some tightening, and that's what we want. You can see after treating the cheek area, you can see it just has a little bit of redness, and that will go away over the next couple of hours. So we do this once a month, so you should start to see in about a week to 3 weeks a little bit of contraction, a little bit of tightening, and a better contour.
And is there lotion or something you need to put on post-treatment, Angie?
Yeah, actually there's hydrogel that we use after the treatment. You'll use that twice a day, and that helps to soothe the skin, not just soothe it, but then also too is you get these tiny little micro scabs, and it helps those exfoliate without harming the surrounding skin.
Is there any type of prep that the patient should do prior to the treatment?
There really isn't. So when you come in, we have you cleanse your skin with a gentle cleanser, then we apply the topical cream. Now, if you're a patient that has darker skin like myself, so it's sort of that Italian olive skin and darker brown skin, even to black skin, you can still use all of these devices, but we would probably pre-treat you with hydroquinone. So I've actually had this treatment done, so I know what it feels like. And so for my next treatment, then I'm going to start applying hydroquinone into the area underneath my neck, and that will help sort of balance the skin so I don't get hyperpigmentation. So for darker skin tones, we would pre-treat with the hydroquinone. Also, if you're using Retin-A, then we usually have you stop that a couple of weeks before. So we don't want anything that's abrasive or caustic to the skin. And then we can, once you get through your treatments, you can resume all of your skincare products.
What is the difference between the Virtue Deep, the Lipo AI, and liposuction?
So really it just depends on what we're looking at and what the patient's goals are. So classically in this area, we have treated with straightforward liposuction, which gets great results. As I've talked about before, I have the Lipo AI device, which I do here in the office, in the procedure room. Again, that's under a local tumescent solution, which I actually inject into the tissue, and I use a laser lipo fiber optic cable to help melt the fat, and then I aspirate it. The nice thing about the laser lipo, it will cause some skin retraction, and we talked about the Virtue Deep. So the differences is really what the patient is, what her or his goals are. And so in this case with Beth, she's got good skin tone. She has a little bit of adipose or fatty tissue. She has a little bit of blunting of that jawline or the mandibular angle. And so we want to tighten that up. So she's a great candidate for this. She's also a candidate for liposuction or Lipo AI. It just depends on whether she wants to do it minimally invasive. The nice thing about this, you come in, as I said, you numb for 30 to 40 minutes. The procedure itself takes 30 to 40 minutes, and then you can leave. You can exercise the next day. So a little less downtime, but you have to do it 2, 3, and sometimes even 4 times, depending again where the area is and what we're going after. Lipo AI is a single treatment. We do it in the office under some oral sedation. So I give you some pain medication and a Xanax. And I also use Pronox, which is a combination of nitrous gas and oxygen. So that'll just kind of sedate you a little bit while I'm numbing the area. After that, it's pretty painless. Patients walk out of the office when I'm done with that. It's usually one treatment. And you can resume really exercising and activity in 1 to 2 weeks. The nice thing about that is it does give you some skin retraction. So some patients want to have just a one-time treatment. They don't want to go to the operating room, but they want something a little bit more than the deep RF can do. And then lastly, if some patients really just want to go to the operating room, I do that under IV sedation. I have an anesthesiologist over at the surgery center. They put the patient into twilight, and then I numb it up and use the same tumescent lidocaine solution that I would do with the Lipo AI, and do the same thing with the liposuction. But that's straightforward liposuction. I just aspirate the fat. I don't use any heat like the laser lipo will do. So I get a little less skin retraction that way. But it's tried and true. Patients are very happy with it. But you have some recovery. Somebody has to drive you in and take you home, and you get about a few days of some swelling, light swelling, a little bit of downtime. But again, you can be exercising again in 1 to 2 weeks, just like the laser lipo. So again, also with the laser lipo, yes, somebody has to drive you and drive you home, and you do get a little bit of swelling, just like the regular liposuction.
Will you get swelling after the Virtue Deep?
So you would get a little bit of swelling, not that much. You'll see all of a sudden you can see that her redness is actually already dissipating even while she's getting her submental area treated, so that's temporary. With this, you might have a day or two where you might see some little micro needling tracks, and that will go away, or as Angie says, a little bit of scabbing. That goes away in a few days. So not a lot of swelling with it at all. Most patients can go back to exercise the next day and go back to work or school. And be out with friends. So social visits are okay in 24 to 48 hours.
Do they need to avoid the sunlight after treatment?
Realistically, not really. We are always asking patients to use sunscreen, but you give it 24 to 48 hours. I really don't have any problem with somebody going out in the sunlight, especially if they're protecting their skin with sunscreen.
was that?
Literally
Any
can't feel a
discomfort?
thing.
Wonderful.
So we're done treating here, and you can see a little bit of redness, but not really much track marks, but just a little bit of redness here. And this is already dissipating from what you saw right before we started this. And again, you can see the outline all the way back here, all the way down to the hyoid bone. And so what we're expecting, if I may, Beth, is that that skin will kind of pull up like that and give her a more distinguished jawline.
So tell me, how did it feel?
I didn't feel anything at all at any of the 3 passes here. On the cheeks, the first 2 passes, I didn't feel a thing, and only just like slight tingles during the 3rd pass. So I was fully numbed. It was great.
Good.
Yeah.
Good to hear.
And Beth has not taken any medication prior, and there's no Pronox with this. So, you know, except for the redness, you know, we can really treat, and somebody can honestly do this and just basically go back to work if you don't mind a little bit of redness at work. So I hope this was helpful, and we're excited about this. I think this is going to be a great addition to our medical spa. If you're interested, please let us know. You can check out some information on our website. Honestly, you know, Ella and Beth have done a great job of putting it out on social media, but feel free to call us, and thank you for tuning in, and we'll see you next time.